Hi, my name is Kaylee, and I am the nurse leader of Azusa Regional Medical Center's Board of Directors. My role as a nurse leader is to spearhead transformation and fulfill the mission, vision, and goals of Azusa Regional Medical Center. Excuse me. Along with this accompanies the responsibility of meeting the needs of our patients. So the focus of today's proposal is centered on the care delivered to adults 30 years of age and older with type 2 diabetes mellitus who have a hemoglobin A1C level of 8% with non-healing skin ulcers in Los Angeles County, but more specifically in the city of Azusa. So the purpose of this business scenario is to allow individuals with type 2 diabetes to better manage their blood glucose levels, treat skincare needs, reduce hospital readmissions, allow easier access to care, and improve the quality of life for type 2 diabetic patients. The focus on diabetes management will not only improve the health of the individual, but also mitigate hospital readmissions and decrease the patient load for inpatient care staff at the hospital. Key advantages of the business proposal are the association of the clinic with the inpatient hospital and the high demand of specialized care needed for patients with type 2 diabetes. The association between the inpatient hospital and clinic ensures continuous growth for the clinic. This is because referrals will continually enter the clinic throughout the year and business will flourish. The distinct care and education required to care for type 2 diabetics requires highly trained staff, and the only other clinic associated with a focus in diabetes management and wound care is approximately an hour away. Disadvantages for the program include a majority of the patients being uninsured, approximately 68%, and patient preferences. For instance, patients may not be able to pay their bills in the allotted amount of time given by the clinic, or patients may have other providers they typically see to manage their diabetes and may not want to see a specialist. So nevertheless, the lack of specialized care at the regional inpatient medical center for patients with type 2 diabetes is creating a high demand for a specialty outpatient clinic. As far as actually implementing the plan into action, it was expected that in January of 2019, the California State Licensing Agency was contacted in order to ensure local, state, and federal regulations were met for the proposal. Then a brief search was done to identify other diabetes clinics in the area. This was done to ensure competing diabetic clinics would not be placed in the same neighborhood as a pre-existing one. Throughout February and into March 2019, the clinic will need to apply for the required licensures, such as registering as a sole proprietorship, corporation, or other entity. It's projected that the clinic will have a profit of about $8,500 within its first fiscal year. But I will address that later when I elaborate on projected costs and revenue. So during the months of April through June, the clinic will need to secure the funds for the first fiscal year. Additionally, the medical and office supplies required will need to be ordered for the opening of the clinic, as well as the medical record system and software used to store the patient data. Medical professionals and other staff will need to be hired in June 2019, and advertisements for the clinic will be posted throughout May and June. As of 2010, so now transferring from the implementation to the projected revenue and expenses, as of 2010, 68% of patients seen in an outpatient setting in the county of Los Angeles were uninsured. 21% had Medicaid and 3% had Medicare. These are the values used to calculate the expected revenue for the clinic within its first fiscal year. For instance, the reimbursement rate from one consult with a nurse practitioner is approximately $96, according to the Center for Medicare and Medicaid Services. So this is the base rate used for Medicare and Medicaid patients while calculating the profit for the proposed budget. Since private insurance companies often follow the rules of Medicare, a basic consult will be approximately $96 for private insurers and self-pay insurers as well, or self-pay individuals. Once the expected percentages of patients seen in each payer group were calculated, as I mentioned previously, these percentages were then applied to the total number of patients seen on a daily basis. in order to get the projected revenue. So within the first quarter, the nurse practitioner is expected to see at least 10 patients per day. This value is 50% of the expected number of patients the NP plans on seeing by the end of the first fiscal year, which is approximately 20 to 24 patients per day. So following this, in the second quarter, the schedule is expected to be at least 60% full, with the NP seeing 12 patients a day. The schedule is expected to be at least 80% full during the third quarter, with at least 16 patients being seen on a daily basis. By the fourth quarter, it's expected the schedule will be 100% full, with at least 20 patients on the schedule per day. Therefore, the goal of the clinic is to see 10 patients per day during the first clinic, 12 during the second quarter, 16 during the third quarter, and 20 in the fourth quarter of the first fiscal year. It is important to note that the associated hospital will continually refer patients to the new clinic, as well as patients from the community. So the goal of the clinic within the first fiscal year is to build a foundation of clients, and then over time the business will become more profitable. It is essential that the patients feel heard and to keep their retention rates high within the first year of operation. This is because if the clinic initially sees a high number of patients but is unable to retain them, then it will be futile. By having a lower caseload, the nurse practitioner will be able to spend more time with patients and be able to create a concise and personalized plan of care. This is an essential part of creating a business in healthcare because it is not only about the profit, but also about the quality of care provided to patients. The projected revenue from Medicare and Medicaid, private insurers, and self-pay individuals is approximately $565,300. So during the first year of operation, the plan is to hire an NP, or a physician per diem, an NP full-time, 2 RNs to work part-time, 2 medical technicians to work part-time, and 2 part-time receptionists. The employees who are part-time are given statutory benefits such as workers' compensation insurance, Social Security, and short-term disability insurance. The NP is given a full benefits package with an annual salary of $127,000, while the physician works per diem and receives a monthly salary of about $3,750 with no benefits. Since the clinic is in California and nurse practitioners are not able to work independently, the physician will work per diem and consult with the NP over the phone when assistance is required. However, the NP is the primary provider at the office. So it's important to note that the NP will be the only staff member who works full-time at the clinic and is also the only individual with a full benefits package. So as the clinic grows over time and the patient load increases, another NP provider will be hired depending on the revenue and demands of the clinic. In addition to this, depending on the overall profit after the clinic's first year of business, the part-time staff members, specifically the RNs and medical technicians, will be made into full-time positions and they will be offered a full benefits package along with a 1% bonus of the revenue from the first fiscal year. This will act as an incentive for the RNs and technicians to stay on for the first year of operation. While the receptionists will remain part-time employees, they will be offered bonuses after the first year of operation. So the goal for the first year is to make a profit of $5,000 in addition to having a patient retention rate of at least 75%. In regards to employee benefits and taxes, the total within the first fiscal year will be $44,764, and the total for wages and salaries will be approximately $292,600. So next, 3 different categories of expected costs include medical supplies, office supplies, and professional or medical services. The clinic will require a hyperbaric oxygen therapy chamber, Green Series 900 procedure lights, various dressings, suture kits, medical gloves, scales to weigh patients, vital sign machines, alcohol swabs, disinfectants, diabetic literature for educational purposes, blood glucose monitors, emergency supplies, an AED, and lab equipment. These are some of the items that will be required for the clinic, and it is expected to cost about $200,000 for the first fiscal year. Office supplies include computers and a computerized system, in addition to phones, chairs, papers, desks, coding books, filing cabinets, registration forms. So the office supplies will cost approximately $43,000 in the first fiscal year. Other professional services that may be required include consults with wound care nurses for highly complex cases, which will be determined on a as-needed basis. In addition to this, the clinic will need to be cleaned on a daily basis to ensure the highest quality of care to provide a patient to care for a patient in a clean environment. So the clinic will be cleaned 2 hours every day at a rate of $40 an hour, and this will be projected to cost about $53,000 in the first fiscal year. Oof. Sorry, excuse me. Thus, the first fiscal year, the clinic's total revenue is expected to be approximately $565,000. And total operating expenses will be approximately $556,000, ending the first fiscal year with a profit of $8,600. The revenue is expected to increase over the next few years as the patient load increases and the clinic grows to meet the needs of the community. So expected outcomes and benefits. The proposed program will allow individuals with type 2 diabetes to have easier access to care by the implementation of an outpatient clinic. The clinic will focus on wound and skin care needs for adults with type 2 diabetes who are over the age of 30 and have a hemoglobin A1C level of 8%. The clinic will also play a critical role in managing patients' blood glucose levels, treating skin and wound care needs, reducing hospital readmissions, and improving the quality of life for individuals with type 2 diabetes. The focus on diabetes management will not only improve the health of the individual, but also mitigate hospital readmissions and decrease the patient load for inpatient staff. So, in regards to distribution of marketing material, marketing is a key component to the success of the clinic. And since the outpatient clinic will be associated with the hospital, the clinic has a huge advantage in regards to receiving a greater number of referrals. Thus, the targeted population for the marketing brochure is for individuals 30 years of age and older with type 2 diabetes mellitus who have a hemoglobin A1C level of 8% with non-healing skin ulcers. So this is the brochure. Let's see. Okay, so I'm not sure if you can read that, but it says, "Your diabetes, our story, together working to improve your health." So, as you can see in the front leaflet, it talks about the clinic and how it is centered on caring for adults with type 2 diabetes with skin and wound care needs. So once you open it, you see the mission and vision. So the mission of the Azusa Regional Medical Center is to educate and empower its clients in order to enhance and improve their overall quality of life. The vision is to be a clinic where everyone feels welcome and walks in with questions, but leaves with those questions answered, along with so much more. Then it goes over the 8 core values, and they're easily remembered by the word diabetes, standing for dedication, individuality, appreciation, brilliance, empathy, teamwork, encouragement, and success. So the inner pamphlet goes over the specialized care offered by the clinic staff and that it is accredited by the American Association of Diabetes Educators. Then there are staff members' testimonies for patients to understand the goals of the providers and staff who work at the clinic. And lastly, the services offered and contact information are on the final leaflet. So the brochure will be distributed in the discharge packet from the inpatient hospital for patients with type 2 diabetes, and will also be mailed to patients who have been treated at the hospital who have a history of type 2 diabetes. So in addition to this, ads and flyers will be posted in the hospital and throughout the community beginning in the month of April. The clinic will also have its own website for individuals who are interested in visiting a diabetic clinic to understand the services that may be provided. And patients will also receive letters in the mail and emails to remind them about upcoming appointments that they have scheduled to enhance patient retention rates for the clinic. So as I said earlier, The clinic will play a critical role in managing patients' blood glucose levels, treating skin and wound care needs, reducing hospital readmissions, and improving the quality of life for individuals with type 2 diabetes mellitus. It will have a positive impact on the affiliated hospital as it is expected to decrease hospital readmissions, in turn increasing profit for the hospital and decreasing the patient load for staff members, which will mitigate burnout and compassion fatigue for inpatient staff members. I would like to thank you for your time, and I hope you can now fully support the proposal for the outpatient diabetic clinic in Azusa. Thank you.